Good afternoon. I'm Jeff Chipman, Chair of CancerCare Manitoba Board of Directors. I'm here with Dr. Sri Navaratnam, President and CEO of CancerCare Manitoba. I'd like to begin by acknowledging that we are on Treaty 1 territory and that the land on which we gather is the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, as well as the homeland of the Métis Nation. The CancerCare Manitoba Board has held annual general meetings since 2015. And this year, we've changed the name to better reflect the purpose of the meeting. I want to welcome you all to the CancerCare Manitoba Board Annual Public Forum for 2020. As you know, the global pandemic has changed many things for us this year, including how we communicate with you. We are fortunate that we are still able to hold this event virtually. This brings with it the advantage of having you join us from across the province without having to travel. Today, we are able to reach you in your homes or other locations that you may be in. Thank you so very much for joining us today. I would like to thank the Honorable Cameron Friesen, Minister of Health, Seniors, and Active Living, and Ms. Janelle Lamontagne from Brandon, Manitoba, for participating in the public forum. We have an exciting and informative agenda that includes remarks from Minister Friesen, a patient story from Ms. Lamontagne, and a presentation by Dr. Navaratnam on the roadmap to cancer control for Manitoba. We will have an question and answer period at the end. This will be your opportunity to engage with us. Since this is a virtual event, the presentations have been pre-recorded. However, Dr. Navaratnam and I will be available to answer your questions at the end of the forum. You'll be able to type questions by using the Q&A tab in Zoom. Please feel free to type your questions as they come to mind throughout the presentations. You do not need to wait until the Q&A segment is over. We will try to respond to you as many questions as possible within our allocated time. At this time, I'd like to introduce the Honorable Cameron Friesen to bring greetings on behalf of the province of Manitoba.
Good afternoon, everyone. I'm Cameron Friesen, Minister of Health, Seniors, and Active Living for the province of Manitoba, and I'm pleased to be bringing greetings to CancerCare Manitoba's Board Annual Public Forum on behalf of the province. Thank you for the organizers for arranging today's event and to everyone who has taken the time to participate. Our government commends CancerCare Manitoba for the vital role that it plays in supporting Manitobans touched by cancer. Today, over 63% of Canadians who are diagnosed with cancer will survive at least 5 years past their diagnosis. Compare that with only 25% in the 1940s. Across Manitoba, we have 33,000 people alive who are diagnosed with cancer over the last 10 years. And sadly, cancer remains the leading cause of death in Canada. And although we have made dedicated progress in the areas of health promotion and disease prevention, the burden of cancer in Canada and in Manitoba remains high, both in human costs and financial costs. It's estimated that 1 in 2 Canadians will in their lifetime have a cancer care diagnosis. 1 in 4 will die of the disease. Oncology costs alone are predicted to rise 7 to 10% annually, with global oncology costs this year exceeding $150 billion. During these unprecedented times of COVID-19, the Manitoba government appreciates more than ever partnerships with organizations like CancerCare Manitoba to provide quality care, support, and protection to our most vulnerable populations and to their caregivers. I want to highlight CancerCare's dedication to cancer prevention, detection, treatment, and care, as well as to research and education for all the people in our province. I commend your continued leadership and action to reducing the incidence of cancer, to reducing the likelihood of dying from cancer, and improving the quality of life for those affected by the disease. I want to applaud you once again for achieving exemplary standing accreditation, the highest level of performance from Accreditation Canada. And I'll briefly just point out some of CancerCare Manitoba's initiatives to date, such as the roadmap to cancer control for Manitoba, including the improved screening methods for early detection. Also, the integrated set of performance indicators regarding quality, patient safety, and clinical outcomes. Also, the work that's being done to enable patients to receive cancer care closer to home, closer to their families, closer to their communities. And also, I would want to flag the support being provided to primary care providers so that they can investigate, diagnose, and refer patients to specialized, complex, and urgent cancer care. Thank you for all of those ways in which you are leading and undertaking new initiatives to support Manitobans. Our government is working hard to transform our healthcare system. As you know, we've consulted with thousands of Manitobans. We have come up with our Manitoba Clinical and Preventative Services Plan. This plan is there to guide good investments, to address gaps, to patriate care back to communities away from Winnipeg. And that means for an organization like CancerCare Manitoba to bring cancer care closer to communities. And so that is an excellent initiative to be undertaking. And we know that the work that we are spelling out in our preventative and clinical services plan aligns with the roadmap for cancer control for Manitoba within CancerCare Manitoba. So that means that Manitoba patients who are battling cancer will also receive that better care sooner that we talk about. Closer to home, through the roadmap to cancer control, we will improve patient outcomes and patient experience. I would want to also indicate that we have added $4 million more in funding to support the provision of cancer care drugs for provinces, for patients in the province. That brings our annual budget for home cancer drugs to over $42 million. In addition to that, we are committing to ensure breast density information is shared more easily with mammogram patients. We are investing $2.4 million for various research programs and projects, and there's much more going on. That's just a snapshot. I want to close by saying again, thank you to CancerCare Manitoba and all of the individuals within the organization and to the board for your dedication to reducing cancer, for cancer prevention, for detection, for treatment, for care, for research, education, for all the people in our province. Your commitment to excellence continues to enhance the lives of patients and families alike. The province of Manitoba looks forward to our continued partnership. And especially, let me just end by saying we thank all the frontline workers, those behind the scenes who are continuing to show up for work in the healthcare system during this unprecedented time when the province is responding to a global pandemic. That takes courage and strength, and we thank you all for the commitment that you continue to make. Thank you for all your hard work. Enjoy today's event.
Thank you, Minister. Thank you for those kind words, and also strongly acknowledging that the burden of cancer that the society faces at very different levels. And it is a reality that the sustainability of cancer services is going to be a problem, not just in Manitoba, but nationally and globally. So we all need to work together to bring these best services for Manitobans. Thank you again, Minister. So I'm Srina Ratnam, President and CEO of CancerCare Manitoba, and it's my pleasure to be here with all of you for this annual CancerCare Manitoba Board Forum 2020. And I'm very pleased to say at this present moment, there's more than 150 people have joined us virtually. So thank you all. We're going to have an exciting rest of 50 minutes, so thank you all for joining. A highlight in the forum has always been for us at CancerCare Manitoba is sharing a patient story. And it is not easy for someone to share the story when that had a profound emotional impact in their life. But I'm very pleased that we have a patient story from Janelle. So thank you, Janelle. And it's very important to hear the stories because we learn from the stories. Sometimes the stories could be very encouraging and affirming what we are doing. At times we need to learn, and it's a moment of learning for us. So thank you today for Janelle for sharing the story with us. Please, all of you, welcome Janelle to listening to her story. Janelle.
Hello, my name is Janelle Lemontang, and I would just like to start off by thanking you for allowing me to share my story. I've had the opportunity to share my story a few times over the past couple years, and every time I do, I feel lighter. My story begins in May of 2017. I was 29 years old and working as a medical speech-language pathologist at the hospital here in Brandon. I was in a career that I loved, had bought my own home, had adopted a pup, and life was pretty much exactly the way I wanted it to be. The only real problem I had was that a couple years prior, I was diagnosed with a fairly severe bleeding disorder. Other than that, I was completely healthy, or so I thought. One evening, I was sitting at home and I felt a burning pain in my arm. It turns out this burning pain was a ruptured blood vessel and I needed to go to the ER for treatment. To make a long story not quite as long, I ended up reacting to one of the treatments I received and ended up back in the ER a couple days later with a severe migraine. Because of my recent bleeding episode, a CT scan was ordered to rule out a brain hemorrhage. And that was when we discovered that I didn't have a brain hemorrhage. Instead, I had a brain tumor. I was 100% asymptomatic, so I was completely caught off guard. Everything just felt so surreal. How did I have a gumball-sized tumor inside my brain and not have any symptoms? I was told that it was likely low grade, and after surgery, everything should be good. The next few weeks were a blur. I don't remember anything really from the time that I was told I had a brain tumor up until my surgery date. I just went through the motions: work, appointments, home. On June 29th, I was in for an 8-hour awake craniotomy. As you can imagine, the surgery itself was not that fun, but the recovery wasn't bad at all. I was sure that the tumor was gone and I was ready to move on with life. I spent time at the lake and joked about how lucky I was to have a month off during the summer. I was ready to move forward and completely forget about the past couple months. Then I got the call that my neurosurgeon wanted to meet with me. I instantly knew that the news I was about to receive wasn't good. I was a nervous wreck the entire drive from Brandon to Winnipeg. Once I got there, I was told that the pathology results came back and that unfortunately my brain tumor was high grade and I would require further treatment. I was sent directly to the brain tumor clinic to meet with my new team. That was my first introduction to CancerCare Manitoba. What followed next were words such as cancer, chemotherapy, radiation, fertility preservation. I was told that the average prognosis for my type of cancer was 3 to 5 years. I met so many people and heard so much information. I remember thinking through all of this: how do people who don't work in the healthcare system or who don't understand the medical system get through this? I had all the resources I could possibly imagine. I had connections that could help me through this, and I was still like a deer in the headlights. I remember crying the entire 2.5-hour drive home from the hospital and pretty much every day after for a while. I would fluctuate between anger and sadness and apathy daily. At times, I thought, what's even the point of treatment? I'll be dead in 3 years anyways. But I proceeded. 2 weeks later, treatment started. Brandon wasn't able to offer the type of radiation I needed, so I made the 5-hour round-trip drive to Winnipeg 5 days a week for 6 weeks. My hair fell out and I had radiation burn on my scalp. I was very fortunate, though, that I didn't experience headaches or any of the other common symptoms of radiation or side effects of radiation. Chemo was a different story. It was horrible. I had 5 days of treatment followed by 23 days off for 12 months. One of the hardest things about receiving my year of chemo was that I really felt a loss of identity. What was my purpose? Why was I even here? If I wasn't an SLP, what was I? I needed something, so I began fostering puppies for the Humane Society. I was already a foster failure with my first dog, so I should have known that I'd end up keeping another. But I think my stats are pretty good. I've only kept 2 out of 7. Throughout treatment, I also traveled. I visited Las Vegas, San Francisco, Boston, Disney World, Niagara Falls, Newfoundland, and my siblings and I all took a trip to New Mexico, a road trip cross country. I didn't want to waste a moment of my life. I finished chemo the end of October 2018. Throughout the entire treatment process, my goal was to return to work, so I rushed back within a month of treatment. Since then, I've been working full-time and having MRIs every 3 to 4 months. I am happy to say that as of this moment, my scans have remained stable. So now that I've shared the Cliff Note version of my story, I'd like to talk more about my experience with CancerCare Manitoba. To be perfectly honest, the worst day of my life culminated with CancerCare Manitoba. That being said, I am so incredibly grateful for the kindness, compassion, and humanity I was shown by every single member of my care team. My physician talked to me, not at me. He asked me to repeat back some of the information to make sure that I understood it. He encouraged me to be an active participant in my treatment plan. And when he asked if I wanted to know my prognosis, and I said yes, he prefaced the stats by saying, you know, this is based on old information. None of this is necessarily predictive of your future. As horrible as the situation was, these small actions made things just a little bit easier. If I could improve anything at all, I would just suggest that all the information is again reviewed at a later appointment once the shock is worn off. After my 6 weeks of radiation, I was able to have my monthly appointments changed to telehealth from Brandon. In addition to saving time and money, telehealth appointments also actually reduced my anxiety. Even to this day, I feel sick when I have to step into the cancer care building in Winnipeg because I associate it with the day I received my diagnosis. I've never had any bad experiences at the cancer care in Brandon, so I find it much easier to go there. As I mentioned earlier, I traveled a lot throughout my treatments. None of this would have been possible without the support of my physician and my care team. At first, I was nervous to bring up my trips that I was planning, as I was scared that I would be seen as irresponsible for placing my immunocompromised self at increased risk. Thankfully, I was fully supported in doing what I needed to do for my own happiness. I may not have always made the best decisions or the safest decisions, but I've made memories that will last a lifetime. And I'm so grateful that I was encouraged to do so. The final part of my CancerCare Manitoba experience that I would like to discuss today is the adolescent and young adult program. After I was diagnosed, I felt quite isolated. I had and still have the most amazingly supportive friends and family, but I wasn't able to share with them everything that I was going through. They were in pain and grieving my diagnosis just as much as I was, and I felt so much guilt to even consider burdening them with my own feelings. I kept everything inside. I would put on the brave, inspirational cancer patient face in public and cry alone in private. Several months after my diagnosis, I received a call from the psychosocial oncology clinician for the adolescent and young adult program. That was the first time that I was able to say out loud that I was scared I was going to die. That was the first time that I was able to say that I was angry that this was happening to me. That was the first time that I was able to say that I was terrified of hoping for a future. Speaking with the psychosocial oncology clinician was a game changer for me, and I truly believe that it was the beginning of my healing process. After our initial chat, I was introduced to and began virtually attending the Young Adult Cancer Support Group in Winnipeg. Then, through the group, I was introduced to the organization Young Adult Cancer Canada. The picture on the slide is our Manitoba group at YAC's Survivor Conference in Newfoundland. This was the first time I actually met face-to-face some other young adults with cancer. CancerCare Manitoba's adolescent and young adult program was my catalyst for connection, and I don't know if I'd be where I am today without them. I'm going to finish my story the same way that I started it, with this quote: "All sorrows can be born if you put them into a story or tell a story about them." Thank you so much for allowing me to share my story.
Thank you, Janelle, for sharing the story. as it is, and also having some insight into what happened to you. So thank you. And there are several highlights in the story. Number one is, I would say, how much of an emotional roller coaster one goes through with the diagnosis of cancer. It's not just them, it's the family and friends. And the support of family and friends is very important. And I was very pleasantly surprised, and she used the word patient-centered care. And when we talk about patient-centered care, it's not that we develop a treatment plan and tell them this is the plan, but we plan it with them. And she highlighted that. So, and also for us as healthcare providers to see what a positive impact that has on our patients. And finally, I think the emotional support that provided by the adult and young adult program, the psychosocial oncology and all that is tremendous help. So, all the support that we provide by healthcare providers at CancerCare Manitoba and as a large health system is very important to ease in a little bit of this difficult cancer journey. So once again, Janelle, thank you. I think now we are going to move forward to the next part of the program where I will be presenting the Roadmap to Cancer Control 2020. You already heard about this through the greetings of our minister, talking about the importance of this roadmap to bring the best care and the best patient experience to us in Manitoba. So here you go, the Roadmap to Cancer Control 2020. Cancer affects us all profoundly. It affects us physically, emotionally, socially, and economically. The most recent Canadian statistics tells us that 1 in 2 Canadians will develop cancer in their lifetime. 3 out of 4 of these Canadians with cancer will survive and live well with their disease. Still, cancer continues to take people's lives prematurely. Within our province, CancerCare Manitoba is responsible for planning and leading a provincial cancer control program to reduce the impact of cancer in Manitobans. Together with our partners, we engaged in planning cancer control priorities for the province. The development of the cancer control priorities began in the spring of 2019. Starting with an environmental scan of the available literature, both locally, nationally, and globally. The important documents include the Manitoba System Performance Report, the Manitoba Cancer Surgery Quality Report, the Canadian Strategy for Cancer Control, and the World Health Organization's report on cancer. The engagement with the staff and all health partners was an important step in reaching consensus. Wide engagement through the visioning session in January included Indigenous partners and patient advisors. Over the summer months, a provincial document was created, led by CancerCare Manitoba, to inform all Manitobans on the priorities for cancer control. I'm very pleased today to present this plan, the Roadmap to Cancer Control for Manitoba 2020, setting priorities, working together, and achieving the best results. Cancer control is driven by research and innovation. CancerCare Manitoba has embedded research into all aspects of our cancer services. The Research Institute at CancerCare Manitoba is dedicated to improving cancer control, making it possible for all cancer patients in our province to participate and benefit from research discoveries. A comprehensive research program directly benefits patients by identifying new treatments and technologies and bringing clinical trials to Manitobans, bringing tomorrow's treatment today to our population. The CancerCare Manitoba Foundation makes this possible by generously funding cancer research in Manitoba, including clinical trials. Thanks to the dedicated support of many Manitobans. Thank you. The cancer control priorities are developed to deliver patient and community-centered care. Manitoba is richly diverse in its population, including ethnicity, socioeconomic status, age, religion, and gender. This, along with the acknowledgement of the challenges of racism and cultural safety, is very important to understand the whole person to provide the best care that is equitable. 6 priorities for cancer control for Manitoba have been identified, each priority with its own specific objectives. Priority 1, promote cancer prevention and screening. Prevention of cancer and screening for cancer to find it early are essential for cancer control. Encouraging Manitobans to quit smoking and to make healthy lifestyle choices to reduce cancer risk are focuses of this priority. We will work to bring new and advanced screening technologies to Manitobans as they are developed. Priority number 2, deliver timely access to quality cancer care closer to home. Access to quality cancer care is in a timely manner is essential for the best cancer treatment and outcomes for Manitobans with cancer. Whenever possible, patients can receive quality treatment closer to home. Primary care providers and nurse navigators are essential players to make this happen. The development of a dedicated inpatient oncology unit for the province is an area of focus towards timely access to quality care. Priority number 3, provide evidence-based, high-quality cancer services. To achieve the best outcome for each individual with cancer, the care they receive must be high quality and should be based on research evidence. Through the precision medicine, highly precise and personalized treatment can be implemented. CancerCare Manitoba is very proud to be the leader in Canada in providing the most current and precise radiation treatment to Manitobans. We are also advanced in our genomic and molecular testing program, including a new genomic lab within our facility in collaboration with Shared Health. Ensuring that all cancer surgeries in the province follow the established surgical standards is very important for cancer control. This is an area of our focus for this priority for bringing high quality cancer care to Manitobans. Priority number 4, improve patient experience through the cancer continuum. The best patient experience brings the best patient outcomes. By providing emotional support, the patient experience is improved. Assisting patients in navigating the cancer system also improves the patient experience. Priority number 5 is ensuring sustainability of cancer services. For us to be successful in implementing the cancer control priorities, we need to ensure that cancer services provided are sustainable, not only for today, but also into the future. By implementing innovative models of care, leveraging the digital solutions, and planning our resources very carefully, we will move towards sustainability of cancer services. Priority number 6, improve First Nations, Métis, and Inuit cancer control and outcomes. Working with First Nations, Métis, and Inuit peoples in Manitoba and in Nunavut to improve cancer control and outcomes is a priority, as these groups often face challenges in accessing cancer services. CancerCare Manitoba will continue to work with the Indigenous partners and communities to ensure that the care we provide is culturally responsive, safe, equitable, high quality, and self-determined. Delivering the best cancer care to Manitobans demands the involvement of the whole healthcare system. The cancer control priorities for 2020 have been identified. We all need to work together to achieve the best results for Manitobans. And we also need the engagement of Manitobans for us to be successful. I look forward to working with all of you to implement cancer control priorities for Manitoba. Thank you.
Thank you, Dr. Navaratnam, for sharing the roadmap to cancer control for Manitoba and for your expert and dedicated leadership that you provide. As a board, we are committed to Manitobans to bring cancer control in this province. We've endorsed the roadmap priorities and look forward to working with the communities to bring the best results. All of us are touched by cancer in some way throughout our lives. We've either been diagnosed by cancer ourselves or have had a partner, child, relative, friend, or colleague touched by this disease. We've either walked this journey or have accompanied someone on their journey. This March, we were all dramatically impacted when the World Health Organization declared COVID-19 a global pandemic. Operations at CancerCare Manitoba were quickly adjusted to reduce the risk of COVID-19, flatten the curve of this pandemic, and to ensure patient safety. The board, through the Quality and Patient Safety Committee, put COVID-19 at the forefront. The board and its committees met virtually throughout this period, and Dr. Navaratnam has provided important updates on the status of the pandemic at CancerCare Manitoba and measures in place to mitigate risk. To the physicians, the staff, leaders, researchers, and research staff at CancerCare Manitoba, we are very aware of the many changes in practice that occurred very quickly. As a board, we are extremely pleased and proud to see the level of your engagement and commitment through these changes in operations. You have risen to the challenge in a fast-changing and difficult environment. CancerCare Manitoba senior leadership, physicians, and staff have been sitting on many tables, including the Provincial Operations Incident Command, CancerCare Manitoba Incident Command, COVID-19 Executive Leadership Team, COVID-19 Operational Responses Team, and CancerCare Manitoba Medical Leadership Team. All of this to ensure efforts are well coordinated. The Community Oncology Program increased their communications and outreach efforts to the community, particularly in the Northern and Indigenous communities. To cancer patients and families, we are very aware how your lives have also been impacted and how the changes in practice have affected you. CancerCare Manitoba remains committed to providing the best care in a safe environment. To the government and public health, who continue to work hard to ensure the safety of patients, physicians, staff, and all Manitobans, we thank you for your leadership. I also want to say, on behalf of the entire board of directors, what a privilege it is to serve on CancerCare Manitoba board. We meet at least 8 times during the year. And in addition, board members are on committees that also meet regularly throughout the year. These committees include representation from CancerCare Manitoba, the CancerCare Manitoba Foundation, and members of the community. I would like to thank these individuals for their commitment to seek opportunities for improvement in the health services delivery and for continuing to adapt through the process of health transformation. One board highlight from the past year included the participating in Accreditations Canada site survey of CancerCare Manitoba sites, resulting in an exemplary standing. We also participated as part of a wide stakeholder engagement in the visioning sessions and the development of the roadmap to cancer control for Manitoba. As chair of the board, I've been participating in meetings related to the ongoing work of the health system transformation in our province, including the provincial clinical network. It has been a real privilege to be part of this process. Now, I would like to take this opportunity to thank the CancerCare Manitoba Foundation and their continued support, especially during this challenging time. Their commitment under the leadership of CEO Ms. Anita Stenning, their past chair, Mr. Doug Harvey, their current chair, Mr. Steve Croft, and their entire board of directors has been so invaluable. I congratulate you on your 20th anniversary in 2020 and look forward to our two organizations' continued relationship. For 2 decades, the foundation has dedicated its efforts to funding research, including clinical trials at CancerCare Manitoba, to attracting the best and the brightest physicians and scientists, and to supporting the needs of the province's cancer patients. This is made possible because of the generous support of Manitobans. Together, we make a difference in the lives of Manitobans. At this time, Dr. Navratnam and I welcome your questions. If we do not have time to respond to your question, please email us at ccmbceo@cancercare.mb.ca. The email address will appear on the screen at the end of the forum. So now I think it's time for our first question. Here's the first one come in. How has COVID-19 affected cancer services in Manitoba? Dr. Navratnam, would you like to answer that?
Thank you. Before I take the question, I'd really like to thank Mr. Chipman, you as the board chair, and the entire board for your commitment and support as always. So thank you. So the question is how the COVID-19 has affected cancer services in Manitoba. We are very fortunate in Manitoba that we did not see a significant change in the cancer services during this pandemic. And except there is some interruption we had to do with the screening of cancer, the screening for breast cancer, colorectal, and cervical cancer, but that's a short interruptions and we are back on it. But overall, as cancer services, whether it is radiation treatment or chemotherapy or seeing patients by cancer oncologist was not interrupted. But the mode of operation was changed. We were doing most of the services by virtually. So people don't have to come to the cancer center for the care, except for treatment, chemotherapy and radiation. And also one comment I have to make about cancer surgeries. And again, we are very fortunate that all the health partners came together and we were able to maintain cancer surgeries through this pandemic. So overall, I would say very minimal interruption during this COVID-19, which is ongoing. Thank you.
Thank you, Dr. Navratnam. Another question. How is health transformation affecting CancerCare Manitoba?
I think it's a very good question, and I'm very fortunate to hear that this was addressed by our Honorable Minister during his greetings as well. So the health transformation is something which has been very positive for CancerCare Manitoba. CancerCare Manitoba has been in fact since 1930s, and one of our goals has always been closer to home, delivering quality care closer to home. And with this transformation, we are very, very fortunate that we are able to advance this mission much further as a system as opposed to just as CancerCare Manitoba. So overall, with the bringing the best care sooner and bringing the best care closer to home, we have been very fortunate to work with this transformation, through this transformation, to advance our goals further. So that was a very good question. Thank you.
Thank you, Dr. Navram. I might just add something to that, because as I did mention earlier, that I've been involved in the process.
Yes.
And I can just say that from the start, it looked like to be a very complicated and difficult undertaking. And I have been just so pleased of how all the different areas of the healthcare system seems to have come together, even through this whole COVID process, continuing to move the project forward. Input from all levels of the healthcare system, it appears, all the regional health authorities, Addictions Foundation, obviously CancerCare, and working with the minister and his Department of Health, and it's moving forward. And I, in looking back at it, I could see the need, how it seems like it would be obvious, but there didn't appear to be a coordinated provincial plan for all the areas of the healthcare. It was very much, everyone cared and worked very hard, but there wasn't an overall provincial plan. So I think it's very important that it's been undertaken, and I'm very confident that it's going to bring real improvement to our healthcare system.
I mean, it is fortunate that cancer has always been planned provincially.
Mm-hmm.
But now with this transformation, the two things, one is bringing care closer to home, best care, and also the other important part of this transformation is provincial planning for other diseases.
Yeah.
So, and that also will be a synergy. Like, for example, when we're talking about surgery, cancer surgeries, when the overall surgery is being planned provincially, it's easy to bring it closer to home.
Yeah.
So I'm very much encouraged how things have progressed and looking forward to it further.
Good. I've got another question. What about inpatient care? I've heard this is a focus. Are you building a new facility with inpatient beds?
No, it's not building a new facility for inpatient beds. But what it is rather is that having a provincial inpatient facility for the province, rather, not a provincial, having a cancer inpatient facility for the province. You know, cancer patients gets admitted for several reasons. One of the common indication is like when they have complication to treatment, chemotherapy and radiation treatment. And of course, for surgery, they get admitted. And sometimes at the end of life care also, they end up in hospital. So as like outpatient care, the inpatient care very specifically addressing the needs of the patient is very important. It's a very specialized care. It's not just the oncologist who are taking care of it, but the nurses and all the other support services, which are very unique to cancer. So having a provincial facility or a facility in the provincial hospital that can be tapped by the whole province is going to be a real asset for Manitoba. So it's not a facility as such, but it's more of a new facility, but that all cancer patients get cohorted if they are admitted for cancer indications. So that's what we are looking for.
Okay. Thank you. I'm waiting for another question to it's quite a question. So if I
go to the top of the question, please. Yeah.
There we go. When it comes to patient planning, how does the communication occur between cancer centers and navigators? Is it appointments and travel from remote communities? I'm sorry, is it appointments and travel from your remote communities in an ongoing communication issue for clients in the north, those under federal coverage and those under provincial coverage? Dr. Navratna?
Yeah, I mean, it is a very complex problem. And so when we have navigators, so we have navigators throughout the province, and we also trying to work through community connectors, especially for the northern region. So they do navigate all the concerns they have. You know, there have been some views about if the system works well, why do we need navigators? But over and over again, we have learned that the cancer patient journey is a very difficult journey, emotional journey. We learn from the patient story today. So facilitating this, how they navigate the system is going to be extremely important. So the specific question about the travel, yes, that can be addressed by the navigators as well. I mean, that's, again, there's a challenge in some of the communities for federal funding versus provincial funding. So we are hoping these navigators and community connectors will be able to help with that for patients. We really want to ease the cancer journey, which has a significant burden on the patients and the family. I see another question as well, Mr. Chipman.
Yes. Do you have any special plans or ideas for the newcomer populations in Manitoba on the cancer care roadmap for the future?
So yes, everyone needs to be identified in that roadmap. I mean, that's what it is. It is for every Manitoban, regardless of where they live, what color they are, or whether they came as a new Canadian or have been here for 100 years. So it's going to touch every Manitoban. So as I kind of presented initially, very briefly, it is a patient and community-centered care. When we talk about community, what is community? Community can be identified geographically, or it could be a one type. It's a newcomer community, it's a community. So that is our focus. So in essence, yes, we wanted to be able to address to the unique needs of every Manitoban. That is the patient and community-centered care.
Okay.
Thank you.
Thank you. What is the leading risk factor for cancer? I'm worried about the environment and pollution. And what about vaping and cannabis?
So I mean, still, if I have to identify one risk factor that is preventable, of course, you know, people get older, that you have more chance to get cancer. So we'll say that's what aging population gets cancer. So you could say aging is a risk factor, which we can't do anything about it. But the things that what we could do something about is, I would say, smoking is still the number one. So smoking, and next is our healthy lifestyle, eating fruits and vegetables, activity, obesity. All those are the leading risk factors. And environment, yes, there are environmental risk factors like asbestos and radon. So I think I would be more concentrating on the risk factors that we could have, we could prevent it, as opposed to going to the things that we cannot control.
Okay, thank you, Doctor. Priority 2 says CancerCare Manitoba wants to deliver timely access to quality cancer care closer to home. But recently, Concordia and Seven Oaks cancer clinics are being closed. How does that help? Isn't that contrary to what you say?
I mean, it's a very good question someone asked. It is very relevant. I'm pleased that I'm able to address this issue. When we say care closer to home, it's the quality care closer to home. I think that's what every Manitoban deserves. And as we talked about, we all have gone through cancer either as ourselves or with our family. So quality care is a very important one. So when we have to have so many small operations or small clinics throughout the city that tend to compromise, I would say, the standard of care, having multidisciplinary care, as Janelle talked about, having the emotional support, having the high quality care, whether it's a precision medicine or clinical trials, is not easy. So the closure of these two sites is for Manitobans to get the best care that they deserve, as opposed to, it may not be closer to in their backyard or very closer to where they wanted it to be. But at least in Winnipeg, we're going to have 3 sites operating that will add some comfort to Manitobans or people in Winnipeg. Okay. So it is not a contrary to what we say. It is a quality care closer to home. That's what all of us have to remember. When the quality is going to be compromised, we have to bring the patient to the quality. when we cannot take the quality to the patient.
Okay, thank you. How are you ensuring that the First Nations, Métis, and Inuit communities are able to be served in an equitable way? The goals in the roadmap are not as clear.
So the priority 6 of the roadmap talks about the cancer control for First Nations, Métis, and Inuit. So we had lots of community engagement. We, when we say we, is CancerCare Manitoba, as well as the National Cancer Agency, CPAC, Canadian Partnership Against Cancer, with the people. And the 3 things they identified as important for them, the First Nations and Métis and Inuit people. There are separate needs, but the higher guiding principle for all those 3 communities are, one is culturally sensitive. They want to get it in their home, closer to their home, in their community, and the self-determined. So we have identified those 3 as the guiding principle for us to engage with the community further and think about each cancer control priorities with this lens. For example, if you're going to say smoking cessation is going to be a highest priority for this cancer control, now we need to think that First Nations community have told us that they wanted to get this culturally sensitive in their community and self-determined. So we have to have action plan to bring smoking cessation through those principles. So that's the next step of work. So we don't have an action plan how exactly we are going to do, but there's going to be further engagement with them, with all these cancer control priorities are important for all of us, whether what community we are in, what color we are in, or what religion. It's going to be important to all, but we need to apply with those lens. So that's how it'll happen.
Okay, thank you. Another question here. How are you ensuring sustainability of cancer services? How do you know you are providing quality care? Have you had a review or an accreditation?
So sustainability is key in cancer services. You know, we all talked about 1 to 2 Canadians are going to be diagnosed with cancer in their lifetime, and more people are living. So the volume of work for cancer services is going to be huge. So everyone at all levels has to think about sustainability. So the sustainability doesn't mean do we compromise quality? None of us wanted to do that. So that is not what it is. We need to think about how could we bring sustainability. First of all, the best care, evidence-based best care is the cheapest care. So when we have these priorities planned, we have a whole roadmap to Manitobans and evidence-based medicine, that itself will reduce cost in the sense, as I said, best care is the cheapest medicine. So that's one, if you could ask, even having this roadmap available to everyone and having an evidence-based medicine, it's one sustainability. And the other things we need to think about is the models of care. You know, we are thinking about virtual care, you know, how, and then the models of care. 20 years ago, 10 years ago, maybe, we had every patient needs an oncologist. Now we have created a models of care. There is an oncologist, there is a family doctor in oncology, there is nurse practitioners, so the model of care. So there are so many ways like that. How do we maintain the quality care at the same time worried about the sustainability of the services? Okay. And the other question they asked about had a review on accreditations. Yes, we had an exemplary status on the review, which is the highest standards. So the quality is not compromised. And so that's, I think that's the question about. So that's,
yeah, and I just to comment on that briefly, you know, the accreditation process is a very thorough third-party independent process that takes a huge amount of commitment from the organization for the information and process that they go through, and we, CancerCare, did that. We also had an operational review by a third-party consultants that produced what we believe was a very positive report on how CancerCare is operated. We've taken that report and used it as a basis of an action part of our action plan and submitted that to the minister for further discussions on identifying some of the priorities that the organization is focused on. So I think maybe we might have time for one more question. As resources are limited, what efforts are made to cooperate interprovincially, nationally, and globally to share cancer research and treatment expertise?
I think it's a good question. It's not just for cancer. For every services, we need to be able to work interprovincially, nationally, and globally. And the question was about cancer research or research. And as I stated initially, the cancer care always embedded research throughout. And we are very much participating in the national front. And then we have done lots of work on benchmarking. That means to see how we are performing in relation to other provinces and globally, which we have done extremely well. So there is already ongoing efforts, and then we are really trying to step up our cancer research further, because without research and clinical research and innovation, we cannot bring the best treatment. So lots of work is going in that arena. So I'm very pleased.
Okay. Well, I think we've got one just came in that I think is important. Winnipeg will have 3 sites for care, is what you said, Dr. Navaratnam. Health Science Center, St. Boniface, Victoria, and the Grace Hospital. That's 4 sites. Is there another site closing?
I'm extremely sorry. I think my number, if I have said 3, my apologies. It is 4 sites at McCharles site and Victoria and Grace sites. Yes, St. Boniface, yes.
So it is 4 sites.
It's 4
Okay.
sites. Thank you. Thank you. I'm glad you took that question.
Okay. Well, I think our time has come to an end. And I want to thank you again for participating in the CancerCare Manitoba Board Annual Public Forum. And finally, I would like to thank Judge Rocky Pollack, who was chair of the Community Connections Committee at CancerCare Manitoba, the Public Forum Planning Committee, Strauss and Avant Pro for helping us produce this meeting. See you all again next year and look forward to it. Thank you.
Thank you.